An ACL is ruptured mainly when you have a twisting injury with a sideways force. So when you're skiing, what can often happen is that one foot gets planted and then you twist your body, your leg also, you need to go sideways. And that's the perfect mechanism for you to rupture your anterior cruciate ligament, or ACL as it's commonly called. The treatment of ACL injuries really depends on the patient and whether there have been other injuries sustained in the knee together with the ACL. So this is when I would like to take a full history, see what the expectations of the patient are, and also at times, if the ACL injury is the only injury, see if a course of just physiotherapy and strengthening the leg is enough. However, in any case, what you'd want to do is keep a watchful eye so that if the person with injury couldn't go back to the sport that they love, then that's when you would think of intervening more urgently. The one other thing and condition is if you tear your meniscus, which is your shock absorber, together with your ACL. A torn shock absorber or meniscus can lead to earlier wear and tear. And ideally, in a younger, and actually even the more older patient profile, what I like to do is repair the meniscus rather than let it either just degenerate away or go and take it out. If you repair the meniscus, what you want is a stable knee. And then in that case, if the ACL has ruptured as well, I'll be more likely to advocate a reconstruction of the anterior cruciate ligament at the same time as the meniscal repair to give it the best chance of healing and prevent the after effects of not having a complete meniscus over the coming years. To avoid getting an anterior cruciate ligament injury in the first place, there are a number of steps someone could take. First of all, prepare for your ski holiday. So just like you'd prepare for a marathon, there are specific exercises you can do to prepare for your skiing that includes working on your legs and ideally going to perhaps a physiotherapist in the first instance that can guide you to the proper exercises. This should be 4 to 6 weeks before you go on your skiing holiday. The second thing is, as we discussed earlier, that one of the main causes of an ACL injury is a planted foot, and often when the binding hasn't come off. So no matter how experienced you are, for the first run, just keep very loose bindings so that if you were to have injury while you find your ski legs, then you're more likely that the ski will just detach itself and you won't have that horrible twisting sideways movement to your knee. The other thing that I recommend is, no matter how experienced a skier, for your very first run, after maybe a whole year of not skiing, or especially now over our recent times, it might have been 2-3 years since someone has skied, is as embarrassing as it might sound, but start on the nursery slopes, then go on the green slope, then on the blues and reds. Now, I appreciate some blues can be worse than reds and some reds can be an easy blue depending on how they've graded it. But if you could go from just a graded approach, just until you find your ski legs and you get your muscle memory back, I think that go a long way to prevent injuries. A lot of the ski injuries that I see either happen right at the beginning of the holiday when someone has gone back to where they left off from, or towards the end when perhaps a little bit more risks have been taken, but generally they're towards the beginning of the holiday. So in summary, prepare well, start slow with looser bindings, and it might only be an hour, it might be a morning, but start the more advanced stuff when you got your muscle memory back.